Hi, I'm Lisa Tan. Welcome to Oxwide, our programme showing you what's going on across our trust. Firstly, the mandatory vaccine for health and social care staff is a divisive topic. Here's our Chief Executive, Ify Okocha, to explain how we're responding to this government legislation.
We understand that mandatory vaccines for people working in healthcare is difficult for many of our staff. What are we doing to help them?
Yeah, so you're absolutely right in saying that it is difficult for many of our staff, but we're doing everything we can. So in the first instance, I think staff need to view this as something that's going to protect them, protect family members, protect our patients and families of our patients. So we've set up quite a number of opportunities for staff to talk through the difficulties, the anxieties, whatever worries they may have. And where possible, we're helping those who have specific fears, such as fears of needles or whatever, to help them have this in as comfortable as a way as possible. But also, I think one needs to emphasize that where people have some difficult questions, that we are making it possible for them to talk to colleagues who are able to answer those questions, just to reassure them about the importance of being vaccinated. I personally think it's important for us to be vaccinated as healthcare workers, and we also need to remember that colleagues in social care had a similar expectation of them last year. And a significant proportion of them successfully got vaccinated. So I would really ask the Chief Exec of Oxleas urge staff to please get vaccinated. We certainly don't want to lose any member of staff, that much I would say. And so we will do everything possible to help, support and encourage people to get vaccinated, including putting up vaccination clinics where possible.
So for people who don't know about the new policy of mandatory vaccines, can you tell us a little bit about it?
So the government has passed legislation that says that from the 1st of April to continue to work in the NHS or indeed any CQC registered facility, and that includes independent hospitals for that matter, you have to be vaccinated. You have to have had your first and second doses of vaccine. And so we have a responsibility to ensure that we support and help our staff to all get vaccinated. And as it stands, you need to have had your first vaccination by the 3rd of February so that you'll be able to then have your second before the 1st of April. And that's really what we're trying to achieve.
Where can people find more information out about what they need to do?
So, of course, I have written out a couple of times to individual staff, to the wider staff group, but there is a lot on the Ox. So if colleagues can just look on the Ox, they will find all the information, the frequently asked questions. They have the opportunity to join some webinars or to ask specific questions of a number of staff who have been supporting the wider staff group for quite a few weeks now. I understand how difficult it must be for some of our staff, particularly those who've chosen not to have the vaccination. But you have to remember that we provide healthcare to a range of people, some of whom are really quite vulnerable. And so whilst you may not agree with the government, I think the principle is right that we are vaccinated so that we can protect not just ourselves and our families, as I said before, but our patients and their families. I personally believe that the vaccination is important, and I will really urge you to get vaccinated. We've put out all the resources that we can out there, questions, frequently asked questions that we've attempted to answer, staff who are on standby to help you with some of the difficult questions you may have. And we're making every effort to see to it that we'll put out enough vaccination opportunities for staff. So I really would urge you to take up one of these opportunities that's out there, because we do not want to lose you as a member of staff.
More information for our staff can be found on the Ox at the address on the screen now. Now, mental health services are experiencing increasing demand for their services. In response, Oxleas have invested in a 24-hour mental health response line. We visited Parvin and her fantastic team of specialist call handlers to find out more.
We are here to ensure that people who are calling the crisis line are receiving time and space to talk about their issues that is worrying them, and also to kind of like tailor-made a plan with them with regards to what their needs are at the time of the call.
Good afternoon, Crisis Line. Sue speaking. How may I help you?
Oh, hi, good afternoon.
Hello.
With regards to my mum.
Yes, okay. What's the problem?
Crisis Line service started in 2018, and it's for residents of Bexley, Bromley and Greenwich. So we work across the 3 boroughs, and the Crisis Line consists of crisis line practitioners and call handlers who are a new addition to the team at the moment.
A lot will be people just wanting advice, some information that we can signpost. Others will be in crisis that we try to de-escalate. And if it's not really happening, we're concerned about a risk, then we'll go to emergency services.
So we have existing service users who maybe are going through a mental health crisis, and it's part of their crisis contingency plan to actually call the crisis line. But we've opened it to residents of Bexley, Bromley and Greenwich, which means anyone can actually call in, family members, friends, carers, and it may be that they know somebody who's going through a mental health crisis and they want a bit of guidance and support. We work close collaboration with NHS 111, the police, London Ambulance Service, and we make sure we are there when they are calling to maybe check if somebody is open to Oxleas and whether they need that information about risk. So this is how we work very closely with them. But with NHS 111, we have something called a warm transfer, whereby somebody would have called them, then they would put that person through to the crisis line if it's a mental health crisis. So the call is put through without any disconnection happening. So then we take on that call and speak to the person directly.
So I've been working with Oxleas now for 4 years, and I joined Oxleas because it's a mental health trust, and being a service user myself, I found it so rewarding, especially now with the crisis line team. I feel like I've found it's like a pot of gold at the end of a rainbow. Coming into work and seeing these people do what they do is inspiring, and I'm so happy I get to be a part of it.
We had a call from a concerned parent about her 12-year-old. So the call handler dealt with that call, and I was in the office so I could overhear the conversation, one-sided, but it took a bit of time to deal with the call. But at the end of the call, that we did not need to do a further referral. The person did not need to attend A&E department. So it was really exploring what was happening in the family household and how to support that parent.
But how many available? We've got 3 people available.
You know, on the screen at Oxleas, all those are on the right.
It was like that until a week ago, and we've got.
It's
changed all of a sudden.
So we never turn anyone away. We make sure that any call that comes through to the crisis line is taken on and explored with the person to see what is the nature of the call, why they've called us today, and how is it that we can help them. So it may be that the person is out of area, so we'll still make sure that we are providing them with the correct information. And if they are within the area, we would actually go through an assessment with them, look at what their needs are at the time. So even if it's minor to the caller, Crisis Line will take it seriously to make sure that we are offering this service to the person.
So there's been a lot of changes recently, and yeah, I think it's good. It's sort of getting bigger, and I think from some of the data we've got as well, the calls, you can see the difference since the team's got bigger. the difference in the data is showing is a good improvement.
So I am feeling positive about the future of the crisis line. There has been a lot of work put in, and it's still a work in progress. So we're looking forward in terms of how do we become a part of the crisis hub that is the future for Oxleas. So we're definitely looking forward to that happening.
I would highly recommend anyone to use the crisis line if they're in a crisis, because even if I've had a down day, I can go and speak to a colleague, and they've been so supportive and they're so easy to talk to, and I can't imagine what that must be like on the phone. And again, I'm involved with their process and their transformation of building the crisis line to be where it needs to be, and to be honest, I think they're already there.
And finally, we've come to our Queen Mary's Hospital site in Sidcup to talk to Aisling Clifford, who joined us recently as Director of Acute Adult and Crisis Mental Health Services. So you joined the Oxleas team fairly recently. How are you finding it with us so far?
I joined Oxleas in late September 2021, so I'm here just coming up 4 months now. And I was lucky enough to join at a time when Oxleas had just completed the transformation from borough-based to service lines. And what that means is that we clustered similar services together. And in my case, I'm the Service Director for Acute and Crisis, meaning that I oversee a cluster of services that look after people when they're at their most acute phase of illness. So I look after the inpatient wards for older people and adult, the crisis teams for older people and adult, liaison services, the crisis line, and other support services within that. So the advantage of me joining at that time is now I'm able to, in sequence and in a very organised way, create consistent operational and clinical practice for those clusters of services. So starting with the crisis line, where we're able to create a consistent service across our 3 boroughs, we'll be slowly working through all the teams. Next, we'll go to the crisis teams to make sure that our 4 crisis teams are largely functioning the same, that have the same clinical model, and it's a great opportunity to reset those teams. It's very important that, as well as creating consistent services across the 3 boroughs, that we don't lose the connectivity to our local communities. So Oxleas has always been known, and I've always known Oxleas as a trust that's truly connected to its local populations and its local communities. So, and I'm looking forward to building confidence that you can have consistent services across the service line while making sure that there are nuances and variations where we absolutely connect to our local GPs, our local communities, and I'm very confident we can do that. So I've really enjoyed my first few months. I found the staff to be so welcoming. I've really enjoyed working with service users and carer representatives in Oxleas. I think including our service users and carers as part of our steering groups and our project groups is going to have a huge impact on Oxleas, because it means that the very people and families that use our services have a direct impact on how we shape them for the future. So I'm very grateful to be here.
Great to have you with us, Aisling. That's all for this edition of Oxwide. Hope you enjoyed it, and we'll see you soon.